Welcome to What's Driving Healthcare Choice in America today. I'm Marsha Hystead. I'm here with my partner, Mike Seyfer. We own HTK Marketing Communications, and we work with healthcare organizations across the country in all kinds of ways and with all kinds of organizations. From branding to strategy to full execution. We particularly specialize in turning healthcare challengers into champions. HTK exists to create a healthy world, and we hope that what we share with you today lends itself to doing just that.
So today, what we want to give you some more insight to is our study that we conducted last year, Healthcare Choice in America. For many years, we read a lot of research about healthcare preference and perceptions from patients all across America. Well, one of the questions that we never answered for ourselves or with our clients was, why would people change? What causes people to change? So we knew going into branding efforts, service line efforts, internal communications, and external communications, what people thought about healthcare, what they thought about their choices in it, but we never understood or took the time to really go into what would cause them to switch. Why would they leave their current provider and come to our clients, or vice versa? And so that's what this study aspires to do, is give us insight to not only what people think, but what would actually get them to change.
We also asked 6 open-ended questions as part of the research because we wanted to go even deeper into what healthcare consumers want from their provider. Our research partner actually told us that in all the years of research that they've done, they've never had so many verbatim answers to questions like this, that people took the time to really tell us what was going on inside their minds and frankly their hearts about what they want from their healthcare provider. So we're going to talk a little bit more about that as well in the presentation today. And we actually produced a book that is available to download on htkmarketing.com that has a lot of these verbatim answers, and we think is very useful.
Just a couple housekeeping things. As we go along, please feel free to send questions. We'll take time at the end of the presentation to go through those questions with you. And if you happen to get called away during the presentation, we're recording it and we'll make it available on our website after that. So let's get started. So one of a little bit about the background of the research, we studied 1,200 people in 6 markets across America. We really were intent on not picking top 50 markets. We wanted to understand what people in mid-America thought and everyday America thought about healthcare and what would get them or cause them to change. A lot of the national research and secondary research that we read really skews to major marketplaces, and we think that there's some difference in behavior in how people think and feel and where they get their information in major markets and what they get in everyday America. So again, 1,200 people, 6 markets across America, and it was done. We recruited online, and it was an online survey.
So we wanted to start today by just using one of those verbatim questions. And the one that we asked is, what has been your most profoundly positive experience? We expected to hear things like curing cancer and taking care of my husband when he was dying and those types of things. But an overwhelming number of people said things specific to what this quote says: a doctor who didn't rush me and listened to everything I said. So caring, compassion, kindness all rose to the top. And of course, another C word would be childbirth. People talked about that great childbirth experience. And so...
in this presentation and the research, there are really about 5 key things that we think you should know. So some of you may have read this already. I'll kind of breeze through this, but compassionate care and customer service are really significant when it comes to actual choice. People make decisions to change because of either positive or, more often than not, negative service experiences. The second thing is that we want to look at everyday and population health. So it's an emerging topic, trend for our clients' populations. and we wanted to see how much it really meant to patients in those markets. So we tested a little bit of that and what patients really want from you, where, who you're competing with, and where they're getting other sources of information. You know, very few of us are actually millennials. I'm 46. I won't share anybody else's age in the room.
Thank you.
But so we really wanted to study millennials in the research. So one of the things that kept coming up is that they're more sensitive. They're more sensitive to service issues. They have less brand loyalty. It's not baked in with them as much. And they're a really sort of pliable demo.
It is true, though, with millennials that they'll search until they get what they want. That's pretty much, they feel like they deserve that. But also, once they find a doctor, a health system that they feel does match what they want, they will stay. They will be loyal. And if you look at the ages of the millennials, they're up to 37 years old now. So these are those young families that are very coveted in the healthcare market today.
Number 4 is that the healthcare costs come up, and there's secondary drivers of choice. We'll talk a little bit about the fact that the anxiety around healthcare costs is greater than people's actual behavior about healthcare costs. But you know, it's an issue we're dealing with one of our clients today. Their costs, and nationally recognized as one of the top hospitals in the country for cost. So we try and put it in context for them. Number 5, and the last thing, is that the value of the primary care physician. We tested where people get their information and how much emphasis they put on different sources of information. And time and again, it comes down to the fact that they trust their primary care doc by a very wide margin over any other source of information. So we get into now some of the choice drivers, and we want to speak to that in a little bit more detail.
So what determines a satisfactory experience? Well, as you see in this word cloud, the doctors are, just like Mike said, are key to that. But then the second biggest word is service. And you think of, and staff, and treatment, and knowledge, and caring. All of those things keep people with you. They want to be recognized as valuable to you, and that you hear what they have to say.
Most of the insights from this, in terms of why people decide to make a choice, sort of one of the things we talk a lot about is breaking the inertia of the consumer or patient's experience every day. You know, so people are in your markets every day. They're going about their lives, and we assume that people are paying attention to all of our marketing. We assume that our marketing has an impact and is going to get people to actual change. So again, part of this was testing that, and we compartmentalized the research insights into 3 things: patient experience, prestige or reputation, and cost, as key categories for affecting patient change. We'll get into the details of everything underneath those 3 in the subsequent slides. So top tier drivers. On a sliding scale, you see that we ask, how important are the following when choosing a local healthcare provider? So the thing that is most important to them are clinical excellence, skilled doctors. On the 1 to 5 scale, you see that 73% of respondents said that this was very important to them. So all of these are top tier, where the number 5 ranking is amongst the highest percentages of all the questions we asked, or all the options we gave them. Insurance plan coverage. In a lot of studies, insurance plan is number 1. Here it ranks number 2. I would say that it's probably equal, you know, number 1 or 2, depending on any study. But around all of this, and we're facing another situation with a client where they're struggling with in-network coverage, and they're going out of network with a significant payer. So while we can't control that, we can control, from a perception standpoint, is the reputation or the perception of clinical excellence, We can control or affect the perception of compassionate care. Through other channels, we can represent the fact that doctors spend time with their patients. So I think that this is especially important right now in a very dynamic, in many states, the dynamics between payers and providers. If you can't control the in-network stuff, you can't control some of these other things and still affect patient change, even in the face of tough insurance scenarios.
The other thing to even notice on here is that all of these listed are well over 50%. They're number 5, very, very important. So.
In the next slide, we get into the second tier of choice drivers, and this is where you start to see in the third and fifth item costs come into play. So it starts to appear in this ranking of different factors. But one important thing that we're going to talk a little bit later about is that we'll show the difference again between patients' anxiety about healthcare costs and their actual behavior. So they say that they're really concerned about it, but their actual behavior, whether or not they leave or come and go from you or your system, there's a big gap between those two. Number 3 is recommendations. Inconvenience appear as top tier drivers, and this is where we see the doctor's recommendation, the second line item on this slide, start to appear. And again, we test that further downstream, and while this is weighted in the context of this one question, how important are the following when choosing a local health care provider? When we pull this question out and we ask what sorts of information people trust, this one really gets blown up. Your doctor's recommendation is actually really big. And last are internally focused drivers. So some brands really leverage national rankings, awards, and recognition. Sometimes they lead with that very strongly. And then, in our opinion, some brands really use that as quality reinforcement, not a leading marketing characteristic, but one that really reinforces other important attributes. So I think it's important that we look at some of this, and perhaps for you, you take a look at how much emphasis are you putting on those rankings awards, how much emphasis are you putting on your affiliation with a larger system, with an academic medical center, or even with religion. We represent and have represented for many years Catholic-based health systems, Franciscan, Benedictine health systems, and at differing times, our clients have felt like we really need to lead with, we are spiritually driven, we are religiously driven, we're a Catholic organization. And you see really today, in today's environment, where these types of things rank amongst why people would choose a provider.
Conversely, if you are a religious organization, to know that it's not something that would keep someone from coming to you.
Exactly.
That it's not that important to them. So back to another verbatim question, what's the most important thing in determining whether you're satisfied or unsatisfied? Overwhelmingly, I pulled this quote because I thought it was great, that if I get good care and they talk to you so you can understand what they're saying. Also really important. But again, things like the doctor listens to me. Access is big. I want to see my doctor. I want to see my doctor. I don't want to see anybody else's doctor. I know that that's a huge issue within health systems themselves. In order to make doctors today be available like that is tough, but that's what people want. And then, of course, insurance costs, like Mike's been talking about. Customer service is a big driver. We had, I kind of call it the 4 C's: care, compassion, competence, and cost. Those are the things people want.
So one of the things we wanted to break down too is generationally, what do people value? So you see here the millennials really are focused on compassionate care, skilled doctors. They do care about insurance coverage, which is somewhat a paradox, right? Because I think in other studies it indicates that millennials maybe aren't overly insured. They don't focus on getting coverage because they think that they're invincible. That is something that they'll address later in their life. But when asked, they do care about insurance coverage and costs. Gen Xers, A little bit more focused on skilled doctors. You see insurance coverage climb a little higher there. They want to spend a little bit more time getting information. So their actual patient experience and all the nuances of it tend to rise to the top. And then with boomers, you see skilled doctors and insurance coverage rise to the top. Doctors who make sure patients that they understand all their options and getting a lot of information. Generally, boomers are more engaged with their physicians. They're there more frequently. One thing about millennials is they're far less likely to have an annual exam. Boomers are far more likely to have an annual exam, as are Gen Xers. So when they're with their physician, and they're with their physician more, boomers are, they want information. They want to spend the time. And that's a big driver for boomers. In the primary care experience or the generalist experience, they don't want to feel like a number. They want somebody that sits with them, that will take the time in their annual exam or other recurring checkups to explain where they are in their life. We did some forced choice questions. We wanted to test a couple things that we could understand if it came down to this or that for different generations. And here we were showing the difference between boomers and millennials, what matters most. So given a choice between skilled doctors and compassionate care, you see that boomers go stronger with skilled doctors. They feel 7% stronger about having skilled doctors versus compassionate care than millennials do. When it comes to either a recommendation from your primary care doctor or a doctor that spends time with me, you see these averages are a little closer. You see some separation on the choice between compassionate care and advanced medical technologies. And then again, hassle-free access to appointments and a recommendation from your primary care doctor. Millennials want hassle-free access to appointments.
Everything.
Yeah, there's no real surprise there. We're filling a couple of questions. The sound is on and off, and looks like we got it back. Thanks for sending that in. So let's go back to that last slide. I hope this is really insightful to you because it's insightful for us and in a lot of our client conversations. So this demonstrates the difference between what people say is really important to them and their actual satisfaction, and then the net important satisfaction score, the net score. So people say that clinical excellence and skill doctor is really important, but generally, there's a pretty big gap between their satisfaction. So every day, I think it's important that when we think about things like HCAP scores, other maybe press gaining, other ongoing measurements that you have at your disposal, you look at things like, okay, people say that clinical excellence and skilled doctors are important. Are we living up to that every day? And you see the difference between where they feel like they are today. So they say that their insurance plan coverage is really important to them, and their satisfaction is pretty far off. Maybe not surprising from the provider side, by the way. And then, things like having, understanding all their options. But when you look at the slide, I think the important thing is then to see where the gap closes and to ask yourself the question, are we delivering on some of these things as well? So are our gaps between importance and satisfaction equally the same? Or are we, as in the lower part of this slide, are we delivering more closely to expectation? The next section really gets into the specific reasons why people make a switch.
So another verbatim, what would make you consider switching? And again, we're looking at actual words that people typed on. Not getting the care I deserve came from a millennial, not surprisingly. That's just something that as they've grown up, they have been handed things. I'm a boomer. I handed it to my kids, so I understand it. But the other things, of course, that make people consider switching, affordable care. More and more with those high deductibles again, We pay more out of our own pocket for our health care, so that's just really important. Obviously, insurance, like Mike's talked about, is a really important thing. But then we get right into like poor service, horrible staff. One person typed in, they should know that the care begins when I walk in the front door. But that's when I consider my care beginning. And so no matter who intersects with your patient in the hallways, on the elevator, at the desk, at the registration, on and on and on, that's where they consider their care beginning. Access, availability, they would switch for bad care, obviously a bad experience. And then we're going to have a whole bunch of doctors retiring coming up here. And with lots of our clients, they're struggling with hiring replacements and all of that. So if somebody's doctor retires, to really think hard about retaining that patient. And in fact, I think we just published a blog this week about that very thing. And then maybe they're looking for higher quality, but isn't it interesting how that's one of the lowest?
So then we get into, we'll pause here. If you have any questions right now, you feel free to email them in. I'd be happy to take a quick pause if you have questions and address any of these slides that we've shared so far. We'll continue to pay attention to our dashboard, and if you do have a question, we'll take a quick pause. So this is where we get into the meat of actual change. So in the study, 30% of consumers say they've switched health systems in the past. So I think we feel like this is a really important number, that in your marketplace, if you extrapolate this across different markets, in general, 3 out of 10 people have switched the health system in the past. That's important, we feel, because we get into maybe a brand effort, a service line effort, as I mentioned before, any type of specific thing. We now ask our clients the question, okay, so what percentage of people are in play? As we start to set expectations for performance for this effort, how much of the market do we feel like we can affect? So we believe that 30% on average is in play based on past behavior. Unfortunately, it is typically negative experiences that drive change, whether it's service or quality of care or cost. But this is a big driver. You see the difference that negative experiences are almost 20 points higher than positive experiences. We like to think that positive and maybe marketing or communicating the positive attributes or benefits of the system, your values, the service line specialization are going to be great drivers for change. But only 19% of people that have switched actually switched because of expectation of better care somewhere else, all on its own. And then, roughly about 42% feel that they've changed because of things outside of your control. So insurance, if they switch insurance and you are not in network with a health system, maybe it's a competitive environment in your marketplace and you are in network, your competition is not, vice versa. Unfortunately, it's a driver. Location, they move, you become inconvenient for them for some reason, or when your doctor retires or moves, that becomes an issue for change. On the negative side, unfortunately, and I'm sure you deal with this every day, service issues are at every point of contact. It's things like, we asked the question, why did you decide to leave? These are the sort of verbatim answers that they gave. And I'm sure that they resonate with you. Perhaps they're even the bane of your existence. But these are the things that move people more actively than passively. And here's where we get into the actual behavior versus anxiety. So in the presentation, we kind of go through it one by one, and I'm going to ask Marsha to kind of go through this and show both. Yeah. And so here, a couple of things. You see that anxiety generally outweighs by a pretty significant margin their actual behavior. So in the second item here, my insurance coverage changed. 66% of people say that they have anxiety about that. but only 21% of people said that they've actually made a change based on that. So I think, this is a difficult one to say because we deal with it in a couple of scenarios today. It's a difficult one to say, hey, don't worry about insurance. The anxiety is, 40 points higher than the actual behavior. But because I think it's different to every situation. But it is something to really pay attention to. Things like you start to get into lack of compassion and kindness. People are concerned about that. I mean, that part is on their mind. But again, only 26% of people would say that they've switched because of a lack of compassion.
But I would just comment that it's closer that in that regard with 26 to 51 if you didn't treat them with compassion and kindness than if their insurance changed.
Yeah.
And so, yeah.
Also, we've got a little sidebar that millennials are much more likely to say compassionate care caused them to switch. So here it is 26%. For millennials, it's 36%. And I think that item just came up on your screen.
There we go.
The next slide is really narrowing down even more. So today, this is an important statistic. Today, 14% of people are thinking about switching. We think that this is a really important number when you consider your efforts on a day-to-day basis. 14% are in play today. They're thinking about it. They're actively thinking about it. A lot of times when we discuss this, either internally or with clients, we equate this to like your checking account. So how many of you have ever switched checking accounts? Banks are out there marketing all the time, and generally there's in our experience, there's a great complacency with people who would ever think about changing their checking accounts. They probably don't even like their bank, but the hassle of changing their checking account far exceeds the satisfaction they have with their current institution. So when we look at something like this, we're trying to determine, all right, how much of the market is actually listening and how much of the market can we actually affect today. So 30% have changed providers in the past. Half that today are thinking about their healthcare scenario today.
We were really surprised, frankly shocked at this number. And as you think about adding 14% to your market share would be significant to say the least.
Yeah, it seems like a small number on paper, but 14% growth, or heck, between 7 and 14% would be significant growth. So this next statistic about change: 21% have gone outside their preferred provider for treatment, and 32% would consider for future needs. The limiting factors in this obviously are insurance. Although, again, millennials in another part of this study feel they have greater choice. They don't feel as restricted by insurance. They feel empowered to make their own decision and go outside of their in-network issues.
So just to reiterate, why did you decide to leave your current provider? Highly disorganized office with outrageously excessive wait times. One thing I think that we can all learn from the compassionate care and service issues is that as you work with every single staff member in your organization, no matter what position they hold, they have huge impact on patient experience. And so if you're a janitor, if you're in a dietary department, if you're cleaning the room, whoever you are, every intersection you make can make a huge difference in retaining patients.
We tested a couple things about attitudes and experience as well. So again, are people limited by where they can go? You see here, actually, boomers rank very high in feeling like they can go anywhere they want. They feel like they have choice, as do millennials. It's pretty equal across the board generationally. There are limitations based on insurance. And then in terms of recommendations, so I can only go to clinic or hospital if my physician chooses. That's a far lower percentage, but they still feel like they have some choice there. as we looked at population health, one of the things we wanted to know is how much does it matter? We have gotten into various efforts with clients, and some very successful in terms of patient recruitment as an end result with it. But 40% we thought was very interesting that want you to help them be healthier every day. They actually want their provider, their hospital, their health system to help them be healthier. And it actually increases as you go upwards generationally. Go to the next slide. You see that the disparity, though, is that most don't even know that you can do this. So 40% want you to help them be healthier. Overall, 60% don't know that you offer the resources. You know what? If we go back to that, I just misquoted that. It is 26% don't know or don't think that you offer those resources. I apologize. 60% know that you offer it. 40% don't know or don't think that you offer it. And that's a pretty big part of your population that really don't know or don't think that you can offer them the ability to be healthier. And when they do, we ask, where do they turn to? And the one insight here is that you're not just competing with the health system across town, the other hospital, the other clinics. You're competing with WebMD, family and friends. Heck, you're even competing with men's and women's health. And ultimately, things like Fitbit and Nike are in the mix. They don't dominate the way that their own healthcare provider does, but people think about, we just thought it was very interesting that people actually trust Nike and Fitbit and other magazines to help them be healthier. Generally about a half to a third as much as they trust you, but it's out there and they are part of your competition.
So we want to end the webinar today with a look at answers to the final question of the research. And the last question that was asked is, if your healthcare provider really knew you, what would they know? What would they know about you? And the answers are so compelling that we've actually made a little book about it. What would they know? That I'm a fighter, that I'm always in pain, that I'm worrying about dying from something that could have been treated if it was found sooner. I'm apprehensive about the aging process, that I'm trying. Someone said that I'm trying. The impression and confidence in you starts at the door. I mentioned that a little earlier. Patients say that they would know that I want to be called back promptly, that they want to be treated like a person, not just the next patient. They want to have the final say in their treatment. They want people that care about them. The listen kept coming up over and over and over again. I want to make sure I understand everything you're saying. I can hear my own 85-year-old mother saying that. I worry, and I'll talk, but you have to listen to me. I don't want to be patronized. I know my body, and they need to listen to me when I describe what's going on. The next one is, I like the truth. I want to have trust in you. I feel like you don't always believe what I'm saying, and it's hard to gain my complete trust in their knowledge if they don't trust me. To know that they're loyal, and again, that's a real trait of a millennial, is loyalty. So, my doctor has the ability to make me feel as if I'm the most important person she's dealing with. That is huge. If I'm happy with a provider, I will stick with them for life. If my healthcare provider really knew me, they would know that I have feelings and I need compassionate doctors. Lots and lots of mental health comments came forward. There were over 700 answers to this question, by the way. Someone said I have more mental health issues than they think. And I want my doctor to know that I'm bipolar, that I have a lot of anxiety. And someone said that not all anxiety is the same. So what this kind of tells me too is that doctors have a really hard job, that there's so much that is going on inside a person when they walk into that session with them. So this might be a cool thing to share with your physicians. And then lastly, see me in totality. I want a strong say in my own healthcare. I am my best advocate. I'm seeking the most natural, low intervention option possible. We saw that over and over again, too. People are like, what can I do without taking a pill? How can I be responsible for my own health in a healthy way? And then someone said, I research everything. So when I come into that appointment, watch out. So again, this book is available. You can download it on HTK, that's her old name, HTKmarketing.com, or you can actually email us and say, I'd like a printed copy, and we can send that to you as well.
And likewise, feel free to email or give us a call if you want to talk about any part of these insights in more depth. We'd be happy to share the details of the actual study, the details of the verbatim responses in greater depth with you. So really, thank you very much for taking the time out of your busy day. It's been a real treat to be able to share this research that we found both helpful and we believe in a great deal. Now, if you have any questions, we will stay online here for a couple more minutes. Field questions, feel free to ask them in the right-hand column of your GoToWebinar control panel, and we'll just sit here and wait for 2 or 3 minutes.
Thanks very much.
Any questions? So we don't see any coming in, but you've got our contact information. And again, if you have any questions as time passes or you want any more detail on any of this, happy to share. And again, thanks a lot for taking time out of your day and joining us.